Within ESMO, there was a lot of data that's come out. The one that I picked up on are 4 main areas. The first was in colorectal cancer with the BEACON study, which showed that triple therapy with encorafenib, binimetinib and cetuximab was far better than the control group, which was chemotherapy, cetuximab FOLFIRI, or encorafenib with cetuximab. I found this trial interesting because it's a second-line trial which has shown improved overall survival and progression-free survival, but it's a non-chemotherapy approach, and I think this is really interesting because chemotherapy post-relapse is not that great, the overall response rate. So I think this is a new exciting area for colorectal cancer and for patients. The other thing that we saw, which is quite important because I do melanoma, is the 5-year updated survival, and that was really good to see the platoon of the curve, so we know that patients potentially are being cured of their melanoma, where 50% of patients are still alive at 5 years. The other bit that was quite interesting was the renal cancer. Not such new data as such, but also they were presenting their new guidelines and which treatment should be used as first-line or second-line therapy. And for pharmacists, for me, it was about sequencing of treatment and being aware of immunotherapy toxicities, especially if you move from ipi/nivo to like cabozantinib as second-line treatment, and being vigilant for toxicities such as colitis or diarrhea or pneumonitis, etc. And then I finally finished off with sarcomas, so it was a bit of a whistle-stop tour of all the ESMO highlights, and I chose a GIST study called ripretinib versus placebo, and this showed reduction in death and improved survival in patients who were given ripretinib over placebo. So I think this will be practice changing because it's a 4th-line study, and it's great to see a positive study in a rare cancer.